Consumers come at healthcare in some very interesting ways, and I'm going to put them into 3 buckets for discussion this morning. The first bucket is the group of consumers that basically ask the question, why should I really care about cost? I'm going to assume that healthcare is the same, it's a commodity, it's same across all institutions. It's not. And because I'm not paying, my employer is paying, somebody else is paying, my insurance company is paying, why should I care about what it costs? The second bucket is a group of people that experienced HMOs, health maintenance organizations, in the late 80s and early 90s. And they're a very interesting group of people. They are desperately afraid that they're going to lose something, so that when they hear about predictive care with a predictable price, they get really anxious, because one of the mechanisms of payment with HMOs was that the less care providers did, the fewer services they provided, the more money they made. So there was a perverse incentive there against quality and against the delivery of optimal care. And the third group, which I'm very encouraged by, they're a group of patients that Brenda is really part of, are informed, they're growing, they're asking lots of questions. They're folks typically that have high deductible health plans. They're part of health savings accounts. They want and need information, but they run into some very interesting problems in the process of getting that information. It is extraordinarily difficult to get information about cost, quality, and outcomes in healthcare. The information isn't transparent. It's not easy to understand after the fact. How many of you have looked at your explanation of benefits and turned to scratch your heads because you have no idea what is covered, what's not covered, what the implications are? Sometimes when these consumers do ask the questions, they aren't welcomed by providers, or the providers don't have the information because they don't know what it costs, because it hasn't mattered. Somebody else has paid. So the critical questions about cost, quality, and outcomes that should be taking place between physicians and their patients don't. There are 2 exceptions to this. One is in LASIK surgery and the other cosmetic dermatology. Both of these reflected a market-based model. And when these businesses first started, the technology was very expensive. There wasn't a whole lot of competition, and the prices, not surprisingly, were high. But over time, as the markets became increasingly attractive to providers, the technology that came in wound up improving but going down in cost, and you have a really nice market model where consumers essentially discipline the market with their wallets and their feet.